Thousands of people across the Palmetto State are serving time behind bars right now while waiting to either be found guilty or not. And over 50% of those inmates are suffering from some sort of mental illness, according to local jail administrators. Forrest Kreider was an inmate inside the Charleston County Jail who repeatedly voiced feeling depressed to staff and cellmates for months. And when his father, Sean Kreider, found out his son had taken his own life in April of 2024.
I was angry. I was really angry and upset that, he'd be unsupervised knowing he'd come out and said he was depressed. He told me he was feeling down.
Even just a day before he was found hanging in his cell, Kreider completed a psychiatric provider initial evaluation, continuing to voice his mental health concerns.
The psych help needs to be there, and there needs to be more support systems in place for those people, for Forrest and others too.
Another Charleston County inmate, Jordan Bell, committed suicide in 2024. But just days before his death, Bell attempted suicide and made suicidal statements, yet he was still taken off suicide watch.
And if somebody's going to reach out and say, I'm depressed, then there needs to be a little bit more supervision, even if it's a 15-minute checklist of, I got to check on this inmate.
Kreider and Bell's deaths highlight a statewide crisis in South Carolina's jails. Over 80 inmates inside South Carolina jails and prisons committed suicide between 2015 to 2021, according to data from incarcerationtransparency.org. And while some jails have in-house behavioral health units to address inmates' urgent mental health needs, others in South Carolina and across the nation do not have any dedicated treatment team or unit.
Sometimes a person that has mental illness isn't going to tell you that. They're feeling ashamed about that, or they're not wanting to share those pieces because they're feeling ashamed of being in jail to begin with. I know that's how he felt. He felt really bad about that situation.
Other than limited mental health resources inside jails, the only outside option for inmate help is one facility maintained by the Department of Mental Health in Columbia. That facility only has 200 beds available, but the lack of physical space is not the only problem.
You can have all the physical space you want in the world, but you don't have enough medical providers trained and ready to deploy to staff those beds.
The Department of Mental Health says as of September 26th, 129 people were on the wait list for a bed in Columbia after a judge ordered them to restoration for 180 days. A competency restoration treatment order is to help get someone strong and well enough mentally to proceed with prosecution and their court case. In other words, preparing an inmate to be competent enough to stand trial.
Particularly for competency restoration treatment, that is a Band-Aid to get you through the court process.
We have judges ordering people for restoration, and there's nowhere for them to go. So then right now we're having these conversations because those people are waiting a year to get this mental health restoration. And in that year, nothing happened. Their case doesn't go anywhere.
Psychologist Kelly Gothard is DMH's Director of Forensic Services and says since the pandemic, the department has seen a 67% increase in competency restoration treatment orders.
So it has been this really massive increase, despite a lot of efforts in trying to keep up. We've been spread very thin and have not been keeping up in the way that I hoped that we could because the resources are just not sufficient at this point in time.
Ideally, the Office of Mental Health would have enough beds for everybody and enough staff to treat everybody, but that's not the reality that we're living in.
The Charleston County Sheriff's Office says 20 inmates were waiting for bed space in Columbia as of August 14th, with that wait sometimes taking up to a year.
That's frustrating. It's a vicious cycle, and it's for them too, because they're not cognizant of what's actually occurring with them.
And even when an inmate can finally get a bed and complete their required treatment in Columbia, the court backlog may force an inmate to wait for months or even years before their criminal case is seen before a judge.
It's not unusual for these people to decompensate because they come back from restoration and they feel good. Then they go up there, they get medication, they get back on track, they become healthy, they become competent enough to be able to participate in their trial. They come back, they feel good, they don't want the medication, and they decompensate all over again.
A 2022 state law now allows jails to provide treatment in-house, potentially reducing the Columbia backlog. The Aiken County Jail is the only currently in the state able to complete both competency evaluations and restoration inside its building.
My staff has been working very closely with the jail on that, and it's been really successful, and it's really reduced the wait times for Aiken.
The next step, being able to fulfill competency restoration orders here in Charleston County. It's currently in the works, but on hold due to understaffing.
If we can do the medication and the individual therapy here and the group therapy here to get them mentally stable, while the Office of Mental Health can come in and do the education component, well then we may be ready to go.
Over 17,000 medications are administered each week inside the Charleston County Jail. Medication is important in treating mental illness, which is why Gothard says within a jail setting, medication over objection is crucial. Under South Carolina law, medication over objection allows mental health facilities and correctional institutions to medicate someone against their will under specific conditions.
We currently don't do that here. And that's one of the significant hurdles that the legal teams and the medical teams are working out. How do we make that happen?
Medication over objection piece has greatly reduced the amount of time that they needed to be under treatment. Having that ability also allows people to be treated more quickly within a jail setting, and it's really no different than in another medical setting.
And for incarcerated individuals like Kreider who are directly suffering, his father is asking for more mental health screening and resources going further.
So I guess to me, that's the only thing I have right now is speaking out. That's the only thing I have is talking about, mental health. There needs to be more of a helping and supportive environment around mental health and helping people who might have those struggles.
If you or anyone you know are having suicidal thoughts, call 988. For Live 5 Investigates, I'm Emily Johnson.